Hello, I'm Dr. Ravi Dravasula, the chair of infectious diseases at the Mayo Clinic, Florida campus. I'm here in my office right now, and because I'm indoors and away from other people, I'm not wearing the mask, though of course Mayo Clinic always recommends wearing the mask and practicing social distancing whenever necessary. I want to talk to you today about my interests and background in international medicine, tropical medicine, and travel medicine, an area that is, I think, going to see quite a bit of resurgence as 2021 moves on. It's been an incredibly challenging 2020 for all of us, for the whole world. Most of our activities have been completely restricted, and the thought of doing travel or going to another part of the world, let alone leaving the house, has been very difficult. But I think those things are going to change, and we'll talk about that in a second. My own background, I'm trained as a clinician in the field of infectious diseases. I obtained my training at the Yale School of Medicine, and that's where I started getting involved as well in international medicine, research on a variety of globally important diseases like trypanosomiasis, seen in Central and South America, leishmaniasis, seen really around the world, malaria, which is again a very important global disease. These are things that I've been quite involved with in the lab, doing a lot of research, discovering new drugs, new therapies, and new strategies, and have also worked internationally at quite a few locations in Asia, in Africa, in South America, with active projects in Kenya, Ghana, Brazil, India, and a few other countries. So really my career of about the last 20 years has been very focused on international medicine and tropical medicine, both from a research and a clinical perspective. I've also been very involved in a field called travel medicine. And this is something, I was the director of our travel medicine program when I was back at Yale. And here at Mayo Clinic, we have a lot of interest in developing a strong travel program. And what it is it's a branch of infectious diseases where we can provide pre-travel counseling. So how to prepare for travel to areas where diseases like malaria or travelers' diarrhea, hepatitis A, dengue fever, some of the things we hear about, parts of the world where these are quite active. We don't see them, fortunately, in the United States, but when travelers go overseas, there's quite a bit of risk. And so we want to be able to provide the counseling and access to vaccines to protect about this for these conditions. The other thing that's very important is that as the world starts to recover from the COVID-19 pandemic, and slowly it's happening, vaccines are rolling out, people are practicing the safe precautions that we hear about, and cases are dropping. And hopefully we'll continue to see that trend through 2021. And there's expected to be a lot of pent-up energy and enthusiasm to go out and travel. So in the era of COVID and vaccines, many of these questions about protecting yourself become that much more important. And so here in the travel program at Mayo Clinic, I'm very interested in working with people who have these questions and try to find ways to protect them. And the other thing that I particularly like, because of my background in international medicine and travel and tropical medicine, now and then, rarely, but now and then, patients come back, travelers come back with an infection. They may come back with acute malaria or leishmaniasis, dengue fever. And we have the expertise here at the Mayo Clinic campus, and my own personal experience working in the tropics and working on international diseases to manage these kinds of things. So the post-travel side of it is also an area of a great deal of interest. So looking forward to working with everyone, people who are interested in traveling. I think it's a great opportunity now to kind of get back to a reasonable schedule and reasonable life, but to do it safely and to be protected, especially in the era of COVID, where parts of the world may not have quite the vaccine status, immunization status of the United States, but working with everyone who wishes to travel and do so safely. Look forward to doing it and look forward to welcoming everyone at the Mayo Clinic in Florida. Thank you and have a great, great day.